Okay, we are live. Good afternoon, everyone. Today's session is going to be really helpful, and it's led by Dr. Rajsri from Apollo Cradle and Children's Hospital. She is going to talk about I am keen on normal delivery. What can I do to achieve this? So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Thank you. Thank you. Yes. So, hi everyone. Welcome to this afternoon's program. The topic that I chose to talk about is something that most of my patients do ask in my day-to-day practice, and I thought it will be a good thing to talk about because it's obviously a very relevant topic. We hear a lot about women wanting to achieve normal delivery. So, first of all, let me start by saying that there are different ways of delivering a baby. Of course, normal delivery is one of those. We do sometimes have to do forceps or vacuum deliveries, or sometimes even a cesarean section. So, there are situations where any of these are possible because at the end of the day, what we aim to do as obstetricians is for the best outcome possible for both the mother and the baby. We do know that having a normal delivery gives you a better chance of getting back to normal life as quickly as possible. It does have fewer complications in terms of how much blood loss happens, in terms of pain that you are left with at the end of pregnancy. Yes, there are benefits of having a normal delivery, but there are situations where it might not be advantageous both for the mother or the baby to have a normal delivery. And in those kind of situations, cesarean section or forceps or a vacuum delivery might become necessary. So, in this scenario, for all women entering pregnancy, we as obstetricians would want them to have the least possible risks both in pregnancy and delivery, and therefore trying to achieve normal delivery then becomes important. But like I said before, do keep an open mind because certain things might not be under your control and you might end up needing other forms of delivery too in the interest of safety of both the mother and the baby. So coming to the topic of what you can do to improve your chances. For this, let me just deal with it a little differently. Um, for a normal delivery to happen, the chances of to give yourself the best possible chance, you need to have a healthy pregnancy. Now, to achieve a healthy pregnancy, what you need to do is actually see your doctor before you actually become pregnant. And this is really important because this would be a time for your doctor to actually talk to you about diet, check on your medical issues, and actually identify any medical problems and treat them before they actually become a problem in pregnancy. So this is very, very useful because it gives you a chance to talk to your doctor in detail about what to expect when you are planning pregnancy and when you actually become pregnant. So, like I said, this is a chance for you to start folic acid to identify, for your doctor to identify medical problems and actually get these under control before you become pregnant. And it's also a good time to talk about diet and exercise so that you optimize your weight before you actually plan pregnancy. Okay, so very important thing to actually do is to see your doctor before you actually become pregnant. Now, when you become pregnant, let us look at what your doctor will be doing to try to give you a best possible outcome, and then we will go on to what you can do to improve your outcome. So, when you become pregnant, what your doctor will do is again recheck on any medical issues and see if they are under control, should you have any medical problems. So, your doctor will do that, make sure that you're on folic acid, which will reduce spine problems in the baby. And also, your doctor will arrange for a dating ultrasound scan. This is a scan that is done in the first 3 months of pregnancy for us to estimate when your due date is. This is a very, very important scan. In addition to also screening for other chromosomal problems, the dating scan is very important because it gives us an idea of what your due date is. Because a lot of the time, what happens why women who even in the low risk group end up with C-sections is because we might be inducing labor before their due date. What we do know is women who are in the low risk group, in those women, we can even safely wait up to 41 weeks before we induce labor. We do know that inducing pains as opposed to going into labor naturally gives you a higher chance of ending up with a C-section. So this dating scan therefore is very, very important because this avoids inducing women too early and therefore ending up with cesarean section when there is no other reason to induce labor in these women. So your doctor will arrange for a dating scan, rule out any medical issues, and also this is a good chance to talk about diet and weight gain in pregnancy. So this is what your doctor will do in the first visit. Also, in your subsequent visits, your doctor will be checking on the baby's growth. Again, looking for medical problems like blood pressure, diabetes, anemia, identifying and treating these problems. Because the better that we get a control of this, it gives you a better chance of achieving a normal delivery at the end of pregnancy. So this is, and your doctor will also be arranging for scans to check the baby's growth in subsequent part of the pregnancy. So doing all this and keeping a close eye on the pregnancy, like I said before, will give you a good chance of achieving a normal delivery. Now, what can you do to prevent this? So let us look at some broad things, some common sense things, and then we'll look at some specific things that you also need to be doing. Number one is follow your doctor's advice. So whenever you have visited your doctor and your doctor has suggested that you do certain things, make sure that you follow the doctor's advice and take all the medications that are prescribed, follow the dietary advice that you have given, have all the vaccinations on time. So the first thing for you to do is to follow your doctor's advice. Number two is eat regularly and on time. What you eat, when you eat, all these play an important role in the baby's growth and development. What happens in pregnancy is that for the first 5 months, there is really no need to change your diet if you're already eating a good balanced meal. And by a good balanced meal, I mean that you should be having 50% of your daily calorie requirement in the form of carbohydrates, which is basically your rice, dosa, chapati. This is your main carbohydrate source. So 50% of your calories should be coming from this. 25% of it should be coming in the form of fat and 25% in the form of proteins. So for the first 5 months of pregnancy, there's no, and of course, you have to have a good amount of vegetables and fruits in your diet that will add on all the micronutrients. By micronutrients, I mean getting enough iron, calcium, magnesium, vitamins that are essential for the growth and development of the baby and also to maintain your own health. Now, all this should be part of your regular meal day to day. So, if you're already eating a balanced meal, so what you would need to do is continue with the same balanced meal. For the first few months, you do not need to make any significant changes in your diet. But from the second half of the pregnancy, your body will need additional protein. So initially, if your body required about zero point 0.8 grams per kg per day, so for a 60 kg woman, you would probably need something like 45 grams of protein a day. Um, and a rough estimate of how much protein something contains, we can look up all this online. For example, an egg, a medium-sized egg, will give you about 6 grams of protein. So work this out and just try to incorporate it in your diet. Now, so initially your requirement would be about 45 grams for a 60 kg woman. Now, in pregnancy, this protein requirement goes up to about 60 grams. So you would need to increase your protein intake in pregnancy. You might not need to make a big change in your carbohydrate intake. What we look at is in from the first part of pregnancy, when you go into the second trimester, probably after 20 weeks, I'm talking about here, you would need to increase your calorie intake by at least another 200, 300 calories. And in the last part of pregnancy, roughly from about 30 to 40 weeks, you need to increase it by another 200 calories. Now, all this information about diet, how much each contains basically is actually available online. So do check it out. In addition, if you're not sure, do consult your dietitian in your hospital who can actually sit down and work all these with you. So when you eat every day, this has to be covered. So you're looking at basically for this is for somebody that I'm talking about who has a normal BMI, which means you have appropriate weight as compared to your height. So when you're that person, then you're looking at taking about 1800 calories in the first up to the first 20 weeks of pregnancy. From 20 to 30 weeks, you're taking about 2200 calories, and then you increase it to 2400 calories between 30 and 40 weeks. So, this is a rough idea. If you need more information, do consult your doctor and your dietitian to help to work out your own diet plan depending on how the foods that you normally would take in pregnancy. So, take following a diet plan that is for somebody in some part of the world may not apply to you. So you might need to sit and work with your local dietitian who can work out a diet plan based on the foods that you are actually eating, what that you are usually used to eating. But make sure that 50% of your diet comes from carbohydrate, 25% from protein, and 25% from fat. Just remember that your fat requirements do not change in pregnancy. It's only your carbohydrate and your protein requirement that goes up. So very important to do this. Why this is important? One, it provides nutrition for you to have good health. Number two, what you actually eat does get passed on to the baby too. So your extra requirement of protein is for the baby's growth and development as well. So once the baby's growth and development is adequate, then that itself keeps the pregnancy healthy and therefore reduces the chance for needing a cesarean section at the end. So food, a very important component of what we should be following in pregnancy to give you the best possible chance of normal delivery. Do drink, the number two, do drink enough water every day. Again, how much water you drink depends on your climatic conditions too, but a rough estimate would be about 2 to 3 liters a day. Why this is important? Keeping yourself hydrated, make sure that your um, blood volume, your circulatory blood value, what actually goes inside your body is maintained, and enough circulation does get passed on to the baby so that the nutrients from your blood gets transferred to the baby. Especially in these hot seasons, it's very important that if you're actually going out, then you will need to be taking additional liquids also. So do make sure that, and especially after exercise, if you're going to exercise, make sure you hydrate yourself before, during, and after exercise too. Also, the importance of drinking water is that it also helps to clear out all the toxins, all the bad materials from your body too. So very important that you hydrate yourself adequately. A good way to do that is to fill up your water bottle 2 3 times a day. Make sure that you've completely finished all the water requirements that you should have taken through the day. So you should be finishing at least 2.5 to 3 liters of water a day. Of course, you increase it if it is very hot and you've been outside. And of course, if you've been all day in AC, then you might not need to drink so much. So make sure at least 2 liters goes in. Of course, more if you're actually outside. Now, what you also can do to help yourself is to take all the nutrients that all the additional supplements that your doctor gives. One of the common medical issues that we see in pregnancy in Indian women is anemia, and that's basically due to iron deficiency. Now, iron, when it is really deficient in the body, does affect the baby's growth and development. So your doctor will be checking your iron levels through the pregnancy and giving you iron supplements, and do make sure that you take them regularly. Iron does not cause your baby to become dark. That is determined by the baby's genes that is passed on from both parents. It has got nothing to do with iron supplements. So make sure that you take your iron supplements every day. That is one thing that you should be following. In addition, you will also be given calcium supplements. Now, calcium is very important for the baby's bone development, and of course, that if you do not take enough, then you will be deficient, and so will your baby. So make sure that you take your calcium supplements regularly. Uh, Quite a few pregnant women do need vitamin D supplements also in pregnancy because we do not spend enough time outside in the sun. So all that also needs to be identified and treated. The third thing that you should be doing is sleeping sufficiently in the day. Now, with women working on the different time zones, especially in the IT sector, this becomes more and more difficult. And what we have seen is a lot of sleeplessness issues, insomnia issues that happen when you're pregnant or not pregnant, non-pregnant also. But we see it more often when somebody is pregnant. The advice that I give to my patients is to follow a regular sleep schedule, meaning if you are going to sleep at 10 o'clock in the night, you should be cutting off all your gadgets by at least 2 to 3 hours before you actually go to sleep. because what is very clear with all sleep studies basically is that the exposure to the light from your tabs, phones, does affect the production of melatonin, which is essential for sleep. So you do need to switch off all these at least 2 to 3 hours before you plan to get to bed. And that will improve your sleep pattern. Also, exercise is a very good method of um, improving your sleep. So for all my patients, I do tell them to exercise for at least to have a light dinner early by about 7 in the night, and also to try to get some exercise between 8 and 9, and have a light snack before they go to bed, and try to go to bed by about 10:30. If that is possible, even if they go to bed late, definitely cut off all your exposure to tabs and your gadgets at least 2 to 3 hours before you actually hit the bed. Try this, and I'm sure that most of you will find that your sleep pattern improves just by doing this. Why is sleep important? Again, during sleep is when the circulation to the baby, the uterine circulation improves. Lying down improves that, and it's also a time for repair of your own body. And you wake up once you wake up refreshed, then a lot of stress that you deal with during the day become more easy to manage when you've had a good night's sleep. So of course it keeps you that reduces your stress levels as much as possible. So sleep is a very important thing that you should, it's also something that you should train yourself to do. So see if you can follow my advice and see if that actually helps you improve your sleep pattern. Now, the fourth thing that you can do is to exercise regularly. Now, exercise has multiple beneficial effects on the body. Apart from the physical strength and stamina that exercise gives you, it's also a very good method of reducing stress that most of us are exposed to in our day to day life. By exercise, I mean at least brisk walking of 30 to 45 minutes every day. I'm saying this for people who have a low risk pregnancy. Of course, there are going to be pregnancies which are higher risk where your doctor will advise that you will have to restrict your physical activity. But for the vast majority of pregnant women, aiming to do at least 30 to 45 minutes is the minimum that we should be doing in pregnancy. And again, walking means walking at a pace where you feel sufficient, slightly breathless, but you should still be able to maintain a conversation. But it's with a little difficulty. That should be how you look at walking. Again, pregnancy for some pregnant women, walking might give slight cramps, a little dizziness in that situation. Do take multiple breaks, but do try to. Once you keep doing this, you will find that your stamina does improve and you're able to walk a bit faster, you're able to walk a bit longer. So it's something that actually improves with constant practice. So do start incorporating this in your day to day life and see the difference that exercise gives you both physically and mentally. So that is the fourth thing that you should be doing. The fifth thing that will make a difference in whether you have a good chance of normal delivery is your weight gain. Um, there is a close correlation between the amount of weight that you put on and the chances for normal delivery. Now, how much weight you put on depends on the weight that you start with in the beginning of pregnancy, and that always should be matched with your height. We do measure something called the BMI, which is a measure of your height and weight. Now, when you start with a low BMI, which means your weight is less compared to your height, we do need to see that these women need to put on more weight in pregnancy so that the baby does not become growth restricted, meaning that the baby's growth pattern is maintained. Now, when people are actually starting off with a low BMI, their weight gain should actually be at least about 14 to 16 kgs in pregnancy. Women in the normal range only need to put on about 10 to 12 kgs through the whole pregnancy. Like I said before, you do not need to put on too much weight in the first half, but of course, in the second half, we are looking at 1.5 kgs per month weight gain through the from about the 20 to the 40 weeks period. Now, why weight is important? If you do not put on enough weight in pregnancy, this can affect the baby's growth pattern, make the baby smaller. Now, these babies will not be able to cope with the stress of labor, and therefore, you might end up needing a cesarean section because of baby's non-ability to cope with the stress of labor, which is called fetal distress. So this we don't see so commonly. Most times when the baby is not grown well inside the mother's uterus, it's probably because of other issues that have compromised the growth, usually not very closely related to poor weight gain. We see it more often when there are medical issues complicating pregnancy, like blood pressure, diabetes, all of which can compromise how the placenta functions. But one of the reasons, which is not very common, is poor weight gain in the mother. So monitoring your weight, making sure you have adequate quantity of nutrients in your diet is an important part of this. On the other side, we see women who put on too much weight. Now, when that happens, we do see that the baby's growth rate is rapid. Babies grow really big, and at the end of the day, labor is basically mechanics, which means that if somebody is to achieve normal delivery, the size of the baby's head should correspond to the baby's pelvic size. This is one of the commonest reasons why women end up with a C-section when the baby is too big for the size of the mother's pelvis. If you see the mother's pelvic size does not change in pregnancy, but if the baby becomes too big, then it does not actually match the mother's pelvic size. That baby is not going to come out naturally. Again, during labor, the position of the baby's head does matter. For example, when the baby is looking up rather than looking down. Now, these are all situations where certain where the baby's head has to rotate into the correct position before it comes out, which means labor in this kind of situation is going to be prolonged and it's going to take time. So some babies, even in spite of that, will still not be able to come out naturally and might end up needing to have a cesarean section. So basically, what you can do from your side is make sure that your weight gain is appropriate. You do not put on too much weight in pregnancy, make the baby too big, and this is going to end up in a C-section with a higher chance will be a higher chance of you ending up with a C-section. So weight gain is a very important thing that you should constantly be monitoring. And if you find that you're putting on too much weight, you need to go back and sit with your dietitian and see why that is happening, and make appropriate changes in your diet, or and also add on exercise at that point in time. Your doctor will also be able to help you to look for other things that can cause weight gain, like fluid retention that can sometimes happen in blood pressure related issues called preeclampsia. So your doctor will also be monitoring you if there is a sudden increase in weight gain also. But if it is mainly to do with your eating habits, cutting down on your calorie intake will help in this situation. Also, the other situation when babies grow too big is when somebody has uncontrolled sugars in diabetes in pregnancy. So that is something that your doctor will be monitoring you for. And a very important part of managing sugars in pregnancy is changing the diet that you will be taking, which means cutting down drastically on the sugar intake in pregnancy, and also adding on medical treatments like tablets or insulin as required, depending on the level of your sugars in your blood. So the other thing that also that you will need to do if you want to achieve a normal delivery is, if and especially if you develop medical issues, is to follow the advice that your doctor has given, so that you keep your blood pressure and your diabetes under good control, because all this will definitely give you a better chance of having a normal delivery. These are under very, very good control. And especially if you go into natural labor in this kind of situation, your chance of normal delivery improves vastly. Okay, so what in conclusion to these are, so again let's go back and then let me try to again just give it to you in point form. What you can do: eat regularly on time and eat nutritious food. Number two, take your dietary supplements like iron and calcium regularly. Number three, drink adequate amounts of water. Number four, sleep for at least 8 hours daily. Number five, exercise regularly. Number six, watch your weight gain. Number seven, listen to your doctor and follow your doctor's advice about managing all the medical problems properly in pregnancy. Okay, so these are the seven things that I think should help you, give you a better chance of ending up with a normal delivery. Now, what I have seen in my practice is the women who achieve normal delivery. They have baby size that is appropriate to the mother's size. Um, they have stayed active through pregnancy. They have followed the doctor's advice on how to manage any medical issues that they might have developed in pregnancy. They do have an open mind. They do ask questions. They do know what is happening in their pregnancy. They have an open mind, ask questions, but they also are quite relaxed about whatever the outcomes are. So these are the group of women that I find have the best possible chance of normal delivery. Now, another very important thing that I do want to talk about to give yourself a good chance of normal delivery is to have good pain relief in labor. Most women find the pain of labor quite difficult to tolerate. And so, one of the reasons that, or a very common reason then becomes that these women, because they do not tolerate pain, and we do know that first labors are going to take a long time, it might take 14, 16 hours. And a lot of the time, because the pain is so difficult to bear, most women then opt at some point of time, even if they don't make progress for 4 to 6 hours sometimes, that they opt to then have a cesarean section. Because of pressure from the patient, from the family, the doctors also then feel then inclined to do a C-section. So what I have found that if you are able to have good pain relief in labor and give yourself a chance to labor longer, that will give you a better chance of achieving a vaginal delivery. So for most women in practice in Apollo Cradle here, we do give them the option of having an epidural in labor. There are different methods of pain relief, starting with injections. There is also a special gas that you can breathe, and the final option is to have an epidural. An epidural basically is a tube in your back around your spine through which local anesthetic is pumped, which actually takes away the pain of labor without stopping the process of labor. What I have seen in my practice is good pain relief for women gives them a chance to relax, to allow the natural process to take place, and give themselves a better chance of achieving a normal delivery. So, good pain relief in labor, having an open mind, being relaxed, all of this actually create an environment where it is more likely to end up with a normal delivery than a cesarean section. So I hope that you found these pointers useful. If you have any questions, you can actually ask now. Okay, I see that there are no questions, so I hope you found this useful. If there are any queries, you can actually wrote it to me, and I will try to get back to you on that. Okay, have a good day.